Hi, I'm Ralph Preston, and on Tuesdays we have these Stroke Buddies, Stroke Survivors Support Group meetings. Rachel liked my idea of putting our brains together, which is one of my brands, and maybe I'm going to be changing it to putting our brains together or adding that. Anyway, on Tuesday mornings, we get together, and if we don't have guests, we chat. And if we do have guests, we feel lucky because we feel like we can learn something from our guests. And today we're lucky to have Rachel Fleischer, who's a massage therapist. Well, first of all, she's a stroke survivor, and she returned to her practice. We'll talk to her a little bit about how her stroke affected her, the way she practices and the way she looks at it. But she's a medical massage therapist and a medical massage therapist, and she specializes in pain. And we had a little chat about some kinds of pain and spasticity that massage can help with. And so rather than me tell her story, I'm going to turn it over to Rachel and ask her to give us a little background on her stroke and her practice. And she has quite an amazing story. It would take at least half of our time for her to tell all of it. So I'm going to ask her to give us a kind of an overview. So we have some time to talk about massage and stroke. So Rachel, the floor is yours. And thank you for coming.
So first of all, thank you, Ralph, for having me. I was born with a condition called hydrocephalus. It's water in the brain. I was lucky enough that it did not interfere with me growing up. In 2020, I woke up from a routine procedure with seizures. Doctors thought that it was anxiety based, which is very common for women when they go into the ER. They did not catch anything. And so my left eye stopped tracking. That was in February of 2020. In November of 2020, a neurosurgeon in New York City realized that what I had was really hydrocephalus. The hydrocephalus had come back. They shunted me, and I started walking again. I had stopped walking. I started walking, but my entire body had shut down. So all of my systems had shut down. My memory, my gait, dermatologically, I had stopped eating. And so they didn't know what to do. And from then on, I started going in and out of hospitals, rehab centers. I'm going to back up a little bit. In 2018, I became a medical massage therapist. I was treating people that were dealing with chronic pain issues, anxiety, and trauma. I continued my practice in 2020. And I just adjusted the way that I practiced. I had to sit down a lot. I wasn't able to stand. So I adjusted the way that I practiced. And dealing with my own pain really helped me to understand my patients, understand what they were dealing with, and to really empathize with them. In February of, I want to say 2022, I ended up in Mayo Clinic for 8 months and I learned how to walk again. I suffered from 3 TIAs, one in 2020, one in 2021, and one in 2022. They all made my body stop functioning. The only thing that Mayo Clinic was able to do for me was make me walk again and make me eat again. And I'm still suffering from multiple issues in my body. Most likely those issues are going to be chronic and lifelong. And doctors are still trying to figure out how to treat those issues and why those issues are still there. My massage practice really functions on people who deal with trauma, PTSD, pain, real pain management, and the fact that I deal with stroke victims, I'm going to use the word victims, really helps me empathize with them and understand where they're coming from. So that's the story, and that's really how my story impacts my practice. So thank you, Ralph.
Okay, sorry, I had to mute somebody. Well, thanks. I heard a whole lot more of your story, and you're quite good at persevering.
So the answer is mute myself.
Somebody else. Okay, Rachel. We have, I guess we've got some people coming in that haven't muted themselves. Okay, I've got you back on the screen. I guess maybe I ought to leave it in gallery view, although I like to put our guest full screen. Anyway, that's more difficult with 30 people and people joining in. Massage is good for a lot of things. Most of us here, or all of us here, are stroke survivors, and we're all dealing with various levels of pain and or spasticity. And spasticity, sometimes if it's severe, can even cause some pain. Why don't you talk a little bit about what you've learned about post-stroke pain and spasticity, since you went through all this, and how you address those things, and what and how massage works, what massage works on, and how it helps with those things. Gosh, that was wordy, Ralph.
Sure. So I experienced it and still experience it. I had to change the way that I perform massage. So when I was in school, I learned that if I want to become a massage therapist who does not burn out of massage, I should not use my thumbs. So I always use my knuckles. That being said, when I suffered 3 TIAs, which for those of you who are not stroke survivors, a TIA stands for transient ischemic attack, which is a mini stroke. And that's what I had. I had 3 TIAs, but mine were different in that they had residual effects, which is not the norm. And that's what doctors are trying to figure out, why I had residual effects. So I have hand tremors, and my extremities are weaker than they should be. And I can't really use my hands for massage because they shake, and you don't want someone massaging you with hands that shake. So I can't really use my hands for massage. So I really use my forearms and my elbows. And I use tools for my hands and my elbows. So that's me. Now, in terms of how massage helps spasticities for stroke survivors, I deal with it in 2 ways. Number one, it helps with relaxation. What I do is I call it low and slow. So you really go very slowly when you kind of go, you kind of go like this. So you massage them very slowly, and it relaxes the nervous system. And then the other thing that I do is I stretch them. So a lot of stretching so that you kind of move those muscles in the way that they need to move, and in the way that the stroke survivor cannot do themselves. And then the other thing that I do is I have them move against me, so resisting against me, in the way that they need to kind of push against me. Again, they can't do that on their own, and they kind of need help. And that kind of helps their brain remember how that muscle is supposed to work. And it really, so there's two things. You want to make the muscles more flexible, and you want to also strengthen their muscles. The other thing that I do is every one of my patients, stroke survivors or not, get homework. No one gets away with that. Now, some of them do it, some of them don't. People who don't do it see the difference. People who do it see the difference. And again, every one of my patients is different. Nobody gets the same homework. Nobody comes in with the same complaint. Every stroke survivor is different. Every stroke survivor comes in with a different issue. Every stroke survivor is unique. Every one of us is unique, and every one of us suffered a different issue. And for all of us, sometimes every hour is different, every minute is different, and we're all in pain in different ways. I'm on different stroke chats, I'm on different stroke groups, and I see different issues that people are dealing with, that their meds are not working, that their issues are different. And a lot of times I just want to tell them, stretch. If you stretch every single day, you're going to see a difference, because when you stretch those muscles, you're reminding those muscles what they're supposed to do. And you're really reminding them that they need to move in the way that they used to move. And you're reminding them that this is how they should have moved, but they're not moving now.
Okay. One of my questions was, what can people do safely in their own or have a loved one do? And you're talking about, you mentioned homework. So obviously there are some things
Yes.
that people can do. Could you, I know that since all strokes are different and therefore a homework would be different, you can't apply it to any specific person, but what kinds of things do you give people to do for homework?
So sometimes it really depends. If people are coming to me for trauma, it might be something as simple as self-care, or it might be something like square breathing. If people are coming to me for pain management, it might be something like, again, stretching, or it might be go buy this particular tool to use for your pain management, so that in between sessions, you use that tool, and that tool will help you when you're not here, right? If I'm dealing with a patient that's dealing with anxiety, I give them tools for the anxiety. So everyone's different, everyone's unique, and no two of my patients are the same, and nobody's dealing with the same issue, even if they come in for the same issue. So even if somebody's coming in for a hip issue, you're coming in for a hip issue, and somebody else is coming in for a hip issue, they're not going to get the same homework, because I interview them and I ask them, what kind of chair are you sitting in, right? How many children do you have? Do you have children? What kind of work do you do? So everybody gets different homework, depending on their specific situation.
Okay. Well, you mentioned tools. Obviously some of the tools are maybe physical tools. Is it safe for stroke survivors to use? A lot of people buy those massage guns or home massagers. Is that a good or a bad idea for a stroke survivor? I went to a neuromuscular massage therapist, and he said they're okay, but stay away from the bones, stick to the soft tissue. So I'm curious what you think about that, because it's something that a lot of people turn to.
I'm just switching spots because I have to charge my phone. So give me 1 second. Is it safe? I would say that again, it depends on the person. Massage guns tend to be extremely strong. So it would really depend on the person. It depends on where they're putting it and how they're using it. So it really, again, depends on your tolerance and if it works for you. You know, again, people ask me, should I go to a chiropractor? So again, it depends on, does the chiropractor work for you? Sometimes people go to a chiropractor and it really works for them. And sometimes people go to a chiropractor and it doesn't work for them. Sometimes people go to acupuncture and it really works for them. Sometimes people go to an acupuncturist and they don't see a difference. So it's very different. I see a question in the chat. So let's just see what the question is.
Yeah, Danny's got
that strong, intense cupping techniques can awaken deficit side skin and muscle sensation. I do cupping. So the way that I do cupping is very different than most people do it. You know, when you go online and look at cupping, you'll see marks on people, right? That's not how I do cupping. I do cupping along with deep tissue, and I do cupping with gliding, together with like, I kind of pick up the cups and move it along the body. So it's almost like I use it in order to move the tissue along. So I do it very, very differently, and it does help stroke survivors. To answer your question, it's not strong, but if I see that it's not helping or if it's making it worse, then I won't use it.
Okay, that's good to know. It was basically a strong sliding technique, and I have no sensation on my left side. I felt my left side torso for the first time in my life, to the point where I thought I was being tickled and almost rolled off of the table. I was so excited.
Yeah. So that can help.
So it sounds like if you're gonna use a massage gun at home, I know because I've asked other people that you should stay away from the bones and stick to the soft tissue.
So I'm gonna say this.
Okay.
I would first try it in a massage therapist's office. I wouldn't try it alone at home for the first time. I have a massage gun in my office, and I would first use it under the supervision of a massage therapist. I wouldn't use it alone at home.
That's what I did. I took mine to an appointment, and he showed me on my hip to stay away from the hip bone. So, and you say they're very powerful. So, well, if you work with your massage therapist, then you should be able to get settings that are right. If you don't have one or whatever, then it sounds like you might ought to start low.
Correct.
Err side of caution on the low side of things. They all have multiple intensity
They
settings.
have different attachments, different settings, different things that you can do with them. Mm-hmm.
Yeah, so let me clarify. This was a massage therapist license. I was having a neuromuscular massage session, and they suggested to do the cupping and just kept working up the intensity until I can actually feel something. And I felt my torso clear as the right side. I couldn't believe it. So it was neuromuscular licensed massage therapist. I would never do this on my own.
Yeah. So that's
Stick? Did it stick?
No. She started in one spot, and I was all greased up, and she slowly dragged it in certain motions. And she was saying it's essentially lifting the fascia underneath the muscle.
That's correct.
And we have millions of nerve fibers in that area, and it just lit me up on my left side like I've never felt since the stroke.
That's correct. Yeah.
I should have said instead of stick, were the effects long lasting? Or
Oh,
did
I'm
they
sorry.
beyond the
I mean, that
session?
afternoon, yes, I honestly can't remember. It was in year 3 of my recovery. I decided to go all in on acupuncture and massage. I would say for the rest of that day, I had generally better feeling and sensation, but no, to this day, I'm still as numb as I was from day 1 after the stroke.
I want to say a little something about chiropractors because I've seen chiropractors. A friend of mine, Marcus, had a stroke, and I went to his chiropractor who he was using as a physical therapist, and I saw something very different than I'd seen in other chiropractic offices. He was doing resistance things like you were talking about, Rachel, kinesiology and such, and stretching and range of motion things. It was not typical adjustments. So I have to do a short disclaimer here because some people have had their strokes because of neck adjustment, carotid artery failures, and such. So anybody who's had issues with veins or with arteries splitting needs to be careful. Adjustments are something that you have to weigh personally, but a lot of people are stay away from chiropractors. That said, like this guy Raul that my friend Marcus was going to was essentially acting like a physical therapist, and he was very good at what he did, and he was getting results. So chiropractors practice across a wide range of things, or some do. Some just adjust you. Anyway, I'll
Right,
shut up.
that's correct. So you have to kind of do your research.
Right. You know, so anybody that had a carotid dissection probably shouldn't get their neck adjusted, you know? I mean, because some people have carotid dissections. I know a woman in New York who started a nonprofit because to bring awareness about chiropractic adjustment, she went out from her session, sat in her car, had a stroke, and like 20 minutes later. And so anyway, enough on, let's get back to massage. I just don't want to, we try and pass out good information here. And I just want to not have anybody think that you're talking about adjustment per se when they go to a chiropractor. As for acupuncture, I think that most acupuncturists don't know much about neuro, and that's why a lot of people don't get good results. And there is a guy, Dr. Jason Howe in Albuquerque, that's trained over 300 acupuncturists, and he revived the ancient Chinese neuro-acupuncture. They've been kind of dead for a couple hundred years, and he and his wife practice it, and they've now trained over 300 people. So I think, again, like, just like a focused approach works best on our recoveries, when the practitioners have a focused approach, in this case, neuro acupuncture versus regular, I think that you get better
Correct.
results.
So there is a concept of neuro-acupuncture, but you have to, again, do your research.
Right. Well, actually, this guy, Dr. Jason Howe, has a website. He's got a map, and with every state in the union, little like Google pinpoints for all the people he's trained, and they've trained over 300 people now.
So Ralph, maybe put his information in the chat.
I can, sure. Well, or I'll put it under the video in the description for sure.
Mm-hmm.
I'd have to go dig up his information to get it in the chat. Well, let's get to massage. I can keep talking and asking questions, but if anybody out there has got questions, unmute yourself. Judy, I see you raising your hand.
Yes. Hi,
Yep.
Rachel.
Hi.
Hi. I'm in Maryland, and I would love to find a massage therapist with your type of credentials. Can you give me any kind of starting point? Is there an association of neuromuscular?
Sure. So the best place to start is there is a place called LMT Success Group.
Can you spell that?
Sure. And I'll give it to Ralph and he'll put it in the description. M as in Mary, T as in Tom, Success Group. And they have a place on their website where you can find, thank you. They have a place on their website where you can find MMPs, which is the licensure that I have, everywhere in the United States.
Great.
Okay.
Thank you.
One of my questions, this is why I opened it up, because it brings me back to another one of my questions, which was, I think I know a little bit about the difference, but I always ask these devil's advocate questions to further the conversation.
Oh, I think I know what you're going to ask. Go ahead.
What is a neuromuscular massage therapist?
Okay.
And
So
and
I knew
are
you
they
were going to ask.
preferable? Are they
What
preferable?
is the difference between regular massage and medical massage? Correct? That's your question?
Or neuromuscular massage? Some people, like my massage therapist, got a neuro certification.
Okay,
Well,
so the
going-
difference, okay, so first I'm going to answer the question of what's the difference between regular and medical. Okay. The difference between regular massage and medical massage. Regular massage is just a feel-good massage. You leave, you feel good. An hour or two later, the effects are gone. Okay. Medical massage, I do a full assessment. You have a problem. We fix it. You get homework so that the effects last for a couple of weeks, and so that eventually you can fix the problem yourself, and so that eventually that problem does not exist.
Mm.
So that's the difference between regular and medical. Okay. Now, neuromuscular massage is where someone is stretching you, someone is dealing with your muscles and the neurons in your brain. So they understand the difference between how the body works and how the brain works. And that is something that a medical massage therapist also understands. So we understand a lot more than what a regular massage therapist understands. So I went to school for massage therapy, and then I went back, got certification in medical massage to understand a lot more and to be able to treat people that have issues and they walk in here. I've had people who walk in here limping and walk out.
Wow.
So that's the difference between me and somebody else.
So Judy, it sounds like if you can find somebody who's neuromuscular, that would be better than feel good. And what Rachel's saying is if you find somebody who's medical massage trained, then they not only understand the neuromuscular part, but they also will bring some additional stuff. And what I got from what you said, Rachel, is what you're doing is working like we do on recovery, working daily towards achieving a long-term goal of healing and being pain-free.
Correct. Judy, if you have issues with the website or with finding someone in Maryland, you can feel free to reach out to me. Ralph is going to put a link to my website and to my contact information, and I'll be happy to help you find someone in Maryland.
Thank you very much.
Sure.
Thank you.
Yeah, I'll put it. I always put anything and everything.
And that goes for everybody. So if you have an issue finding someone, I'm happy to help.
Well, that brings me to another point. I didn't write it down, but I remember from our conversation that you do some things via telehealth or Zoom or whatever you want to call it remotely. So maybe you could talk about, obviously you can't touch people through Zoom. That's Zoom 2.0 or 3.0 at least. But there are some things that you can do. If you want to elaborate on that, there might be some people here that might be able to use your services. And Angelia will come to you next.
Sure. Okay. So when COVID hit, and I could not touch people, I kind of pivoted and changed what I did. And obviously after COVID, kind of changed and I was able to touch people, I was able to reopen my practice. But when COVID hit, I offered Zoom services to people. What I did with that was I offered consultations where I assessed what the issue was. I did a very thorough intake. And then I offered them a couple of things. So I offered meditation, mindfulness, stretching exercises for people that needed that. And I offered them whatever it was that they needed. So if somebody came in, I'm going to say came in, right, with, let's say, a neuromuscular issue, we did stretching exercises together, and I made sure that they had the tools that they needed. And we did it together for a while, right? And I sat with them. I made sure that they had the tools. And also, when I do stretching exercises with clients, I make sure that it fits into their lifestyle. So I'll ask them, okay, tell me what your day looks like and when you think you're going to do this. So it's not like, okay, here's an exercise, go home and do it. What does your day look like? When do you think you're going to do this exercise? Because if you're not going to do it, I'm not giving it to you. And then, because it's a moot point. And then again, the same goes for trauma patients. So if somebody comes to me with a trauma issue, we'll do square breathing, and I'll do it until they're comfortable doing it on their own. We'll do self-talk. We'll do, I'll teach them different mindfulness techniques. I'll teach them, there's a lot of different techniques out there that they can do on their own, but it really depends on what they're comfortable with. If somebody comes to me with a sports injury, if somebody comes to me with it, it really depends on what they're dealing with. And we'll talk about apps that they can download on their phone to sleep. Sleeping is a very big issue in the United States for a lot of people. Insomnia, especially during COVID, was a major issue. People had, and still have, a major issue with insomnia. Stroke survivors have a high rate of insomnia. We have a very high rate of pain and insomnia. And so I would teach them different techniques to be able to fall asleep, what to do, which apps to download, how to fall asleep, what sleep hygiene looks like, and then I would follow up with them. Did you do it? Why didn't you do it? What didn't work? How do we change what didn't work? And it's okay if it didn't work. Don't be embarrassed that it didn't work. Sometimes things don't work, and that's okay. So we're going to change it. So that's kind of what I did. And it wasn't like just a coaching session. It was more of like, and if they needed to do massage on themselves, I would teach them how to do massage on themselves. If they have a partner at home that can do massage on them, that partner would come on Zoom with them, and I would teach them the massage technique. And they would sit there and they would do it until they were comfortable with it. Once they're comfortable with it, we would talk about whether they actually did it. Often the partner didn't do it. Because they were busy, because they were tired, because they came home from work and they had something else to do because they came home from work and they wanted to veg on the couch. Sound familiar? Because they were at work remotely and the soup was sitting on the stove and they wanted to eat it. So we talked about why it didn't work for them. And we found a different time that worked for them. And they did it. Eventually, it worked for them and we found a way to make it work. So that's what I did during COVID. I still do it remotely for people that need it. And for stroke survivors that need it, I can do it. So
Well-
that's the answer.
Wait, I have a question.
Sure. Hi, Winnie.
Hi. You talk about your massage and all that.
Yeah.
You give them homework and they cannot do maybe you give 5. If they cannot do all 5,
I
Can
don't
they
give
skip it?
5. I only give 2 or 3.
okay,
Nobody
whatever.
gets 5.
If they cannot do all 3, and then can they skip it for the next session you see them, and then they explain to you why they didn't see it? And how long do you do your exercises for?
So if they get 3, they'll usually get, let's say we say, okay, you get 3 and you do 10 of each, right? You'll do 10 of each of this exercise when you go to bed. You'll do 10 of each when you wake up. You'll do 10 of each at dinner time. So it's not like you're doing 10 of each all at the same time. Does that make sense?
Yeah.
And if that doesn't work for them, we talk about why it didn't work for them and we change it up. And maybe they need 2. Maybe they can't do any and they need to come more often. Maybe they can't do any and we need to talk about why. Maybe they're too tired and we need to talk about sleep hygiene, right? So maybe we need to change up what we're dealing with. Does that make sense?
Yes.
Couple quick things.
Sure.
It sounds, I hate to use it so overused word, but it sounds like you are holistic. You're trying to deal with the whole person, the whole issue in your practice.
That's correct.
pretty much just a statement. The one thing I want to say to this group and anybody who tunes in on YouTube is I hope you paid attention to what she was saying about the back and forth, about the interaction, about the homework, about the follow-up, about, okay, this is slightly different. So now we're going to adjust course, because this is what I think you should look for in a massage therapist, also in physical and occupational therapists. If you don't have this level of involvement with somebody like Rachel's talking about, then you might not have the right person that you're working with, because this is how problems get solved. It's not by like looking in the book and saying go home and do this and not following up, not checking on you, not measuring the progress you're making, that and adjusting it if necessary. So I just want to bring that to everybody's attention. And then we have one question in the chat that I said I would ask for somebody. And they say, I have a cervical rod and post 2 strokes. Is it safe to do massage with a cervical rod?
It is
Question mark.
safe. Yes. It's safe as long as you have a massage therapist that knows what they're doing. Don't touch the cervical rod, touch around the cervical rod. So for example, I have a shunt, okay? You could give me a scalp massage, just don't touch the shunt. So it's the same thing with your cervical rod. Don't touch the cervical rod, touch around the cervical rod.
How would you know if you have somebody that is experienced and knows that?
Go
I
to a
guess
medical massage, go to a medical massage.
okay,
therapist.
so
Don't-
basically,
Don't go to any massage there. Don't go to Massage Envy. Don't go to Hand and Stone.
right.
I'm just
so,
gonna say it. Don't go to those places. They're not gonna know.
right. Okay. So So it just says Galaxy Tab. I don't know if it's a he or she. So they should make sure that they find a medical massage therapist if they have a cervical
And
rod.
when you go to the medical massage therapist, interview them beforehand. Don't be afraid to ask, what are your credentials? What is your experience with stroke survivors and with someone who has a cervical rod? Have you dealt with that before?
Do
Don't be
you get,
afraid.
I assume you don't get offended when people ask you your credentials.
No. It says it on my website.
Well, I know, but I mean, if somebody asks you, you wouldn't get offended. Because
No.
see, most people won't ask because they think that they're going to like upset the relationship, upset the therapist, and so they won't ask.
I want people to be comfortable with me. So no, absolutely not. Please ask.
That's the answer I was looking for. And anybody else out there should also feel comfortable with you questioning them. They should look at it like that they're relationship building, not that you're trying to pick on them or question their knowledge. Because
If your
anybody,
massage therapist is offended, they are not the massage therapist that you want working on you.
bingo, that's what I was getting ready to say. I prefer when you say it though, because you're the expert. Judy, it looks like you.
Yeah, that leads to the next thing, Rachel. What types of questions or what specific questions should you ask that person when you're interviewing them?
Well, it really depends what your issue is. So for a stroke survivor, you want to know, what's your experience with stroke survivors? If they haven't had experience with stroke survivors, it's okay, right? But you want to know, are they comfortable dealing with a stroke survivor, right? You want to know how they're going to deal with you, right? You want to know how much time are they going to give you? What kinds of questions are they going to ask you? What's their intake like? Do they have an intake form? A lot of massage therapists don't have an intake form. I have an intake form, and people are sometimes offended by that. They're like, oh, there's paperwork? And I'm like, yeah, there's paperwork, right? You want to know, how are you going to change the massage because I had a stroke? Is the massage going to change because I had a stroke? You want to know, are you going to, are you going to work on the side that's bad? If you're going to work on the side that's bad, what are you going to do differently? Right? You want to know, today I'm in pain over here. So are you only going to work on that? Right? You want to know, how many sessions are you suggesting because of that? So those are the questions that I would start with, and then kind of go from there.
Okay, then I'll make another point, is that before you even talk to this person, you probably should sit down quietly and write down some notes for yourself as to what your specific areas of need are. In other words, have a good understanding of your own body and what your needs are so that you can communicate that to the massage therapist as well.
Well, I always ask prospective patients, why are you coming to me? I have 4 areas of why people come to me: stress, relaxation, injury rehab, pain management, and a 5th one that I just added, which is trauma. Okay, so that's what I ask my patients. Many massage therapists don't ask their patients that, but you can add on your own what your needs are. Someone in the chat just asked where I'm located. I'm in northern New Jersey, in Hillside, right near Elizabeth. I have people that come to me from all over New York and New Jersey. I'm 8 minutes from Newark Airport. So if you're stuck in Newark because of a flight, or if you just came off of a plane and you're tight because you sat in a seat, you can come to me.
Judy, I think that, yeah, any information that you bring to a relationship is good. So I think Rachel was saying that, reinforcing that too. Also at the bottom of that list, I'd put what your goals are, because if you should, any type of PT, OT, massage therapist or whatever, if you're not discussing goals, then you don't know what road you're heading down. You don't know what the target is.
Correct. I just want to bring up one other thing.
Sure.
One of the other things that I do is I also very often will talk to a patient's doctors, physical therapist, or OT. You have to sign a HIPAA release form for me to do that. But the reason I do it is so that I understand what we're dealing with, what your goals are, and why you're coming to me. If there's a real issue that we're dealing with, if you're going into surgery, if you just came out of surgery. For physical therapy, if they're already giving you stretches, I'm not giving you stretches. You're already doing stretches. I'm not interested in overloading you, right? But I want to talk to your physical therapist because sometimes they're giving you the wrong stretches. And I think they need to switch it, right? Or they're working on the wrong thing and they have no idea, right? I have patients that come in and tell me, oh, well, they're working on the bike and they're working on this and they're working on that. And it turns out that you have pelvic floor issues and the PT doesn't even know. So I'll talk to the PT. And that's a piece of information that you as the patient need to know, because sometimes there are massage therapists that won't talk to a PT, OT, or doctor.
We know they don't, because we don't. I mean, a lot of people are laboring in the delusion that's still in the 1960s when doctors actually sometimes did talk to each other. But anybody here ever signed a release form like that? I haven't, not for. And I bet nobody here really has. What does that mean? That means that your doctors are not talking. So if you can find somebody like that, like Rachel, who's doing that interaction with your other therapists and rest of your medical team, that's a real plus. Rachel and I, this is an aside, but we both share this semi-delusional dream of connecting somehow in a better way the medical community with the stroke community. And one of the things, Rachel, that would really be key to that would be to be bringing back this interaction between clinicians, because that's one of the things that's really lacking today in the care that we get. Your doctors, you know, they walk out that examining room, they don't look at your chart, they don't talk to any of your other doctors. Next time they think about you is the next time they walk in an examination room and go, oh, it's you again. And that's the way it is. Angelia, you've got a question, unless Rachel wants to respond to that in some way.
Go ahead.
Go, Leah. Asked to unmute. Well, you have your hand up anyway.
I'm curious to see what your thoughts are around maintenance work. I find that, and I'm a trauma survivor, not just a stroke survivor. The stroke happened due to the trauma that I suffered, and I am real curious how, like, in this, I'm finding like these different modalities working incredibly well. I was in a wheelchair. I didn't have any movement on my right side. I didn't have any vision. I got all this stuff back. But I'm also noticing that on the days that I decide to take a rest day, or if I'm a little under the weather and not feeling quite up to it, my body gets significantly heavier and tighter. And I live a very clean lifestyle. I've gotten very strict with my food intake and my nutrient content that I'm deciding to put into this body. I use it as fuel and medicine to heal. So I have to think that most of that is related to the lack of movement on those particular days that I choose to rest in or what have you, which don't come very often, which surprises me that I begin to feel that droop again, and I begin to feel that sensation of concrete, like forming in my body. And I get right into my activity again. And once I get into the activity and like moving and stimulating the muscle response, the fascia movement and breath with it, I notice that sensation tends to slowly disappear again, but I can't seem to keep it gone. It always has like a revolving door where it's constantly coming back. My question really is, do you think that, or are you finding that there is like, for people that have had such neuro damage, are you finding that there is a maintenance schedule, for lack of better, words? I almost think like we weren't taught to use and maintenance the garage that we live in, and
Right.
we really
So-
have to do some work there. Is that your thought too, or?
So to answer your question, I have a question. How long is your stretching or exercise schedule on a daily basis?
I usually do anywhere from an hour to 2 hours daily.
And that's why you have days of rest.
Yes.
Okay. Try to switch it to a half hour.
Oh my goodness. I don't know if I could do that.
You could and you will, because that's why you have rest days. Because you cannot maintain it when it's 2 hours. It's not physically possible. Try to switch it. If you can, take those 2 hours and split it up to 7 days a week. And then once you split it up to 7 days a week, you'll have a half hour a day, and then you'll be moving every single day. For those of us, and I see some of you are in wheelchairs, for those of us who are wheelchair bound, you can do sitting exercises, a half hour a day, 7 days a week. Your spasticity and your pain is going to go down as well.
Okay. What about doing one in the half hour in the morning, half hour in the afternoon?
I would do 45 minutes.
In one session rather than 2 sessions?
No. You can do it 45 minutes a day and split it to 15, 15, and 15. But I wouldn't do it all at once, because what happens to your body is you're going to end up in a lot of pain. Stroke survivors end up in a lot of pain. You're sending pain signals to the brain, and you're going to end up in a lot more pain and spasticity.
You sound like you're fucking scared.
Yeah, I don't ever do a stretch of 2 hours all at once. I always break that up into like an hour in the morning or an hour in the afternoon type of thing, or evening. And I do understand where you're coming from. Should I hone it in to be a more precise movement? That's the thing I've struggled with, is learning how to formulate these precise movements that my neuro and muscles need, to grab a hold of that memory that still lingers within it and return to functional movement and balance. You know what I mean? Do you think that by breaking it up and doing it daily, it actually sets those memories in a little bit quicker or better or more effectively, I guess is the word I'm looking for?
Well, if you're doing it daily, but you're telling me that you're not doing it daily and you're having rest
I usually take like a rest day, like once or twice a week. I'll take a day, I space those out for sure, because I've gotten quite active, and I do notice on the days that I'm really, really active, I am quite fatigued earlier in the day.
And that's the issue. And that's exactly the issue. Because you're doing too much for your body. Your body's telling you that it's too much. So
Yeah.
try to move it to
You
maybe,
sound
let's
fucking-
say if it's 2 hours, try to move it to 1 hour.
Okay.
Well, the other thing is
Interesting.
she's
Thank you
not
for your
doing,
input.
she's not doing all one thing. Because I know she does balance stuff and walking and stretching and a number of things. Angelia, you got to be, Angelia is, leads our breath class. We've done 43 of them. She recently became a certified breathwork instructor. So I'm
We
sure
can, Angelia, we can talk privately and I can kind of guide you with that.
Awesome. I'll get your info from Ralph.
Yeah,
Thank you.
Yeah.
sure,
I
sure.
figured, Angelia, you were probably pretty happy to hear about mindfulness and breathing and such, and when Rachel was talking earlier. Because well, we have a wellness group that Angelia and I run, and we deal with yoga and breathing and wellness, and I guess we ought to add massage. I guess we will be. I guess we will be when I post this in that this conversation in that group. But maybe we ought to make it a fourth focus for us. So, anybody else out there got a question? Okay, I see Nancy waving her hand. You got to unmute yourself, Nancy. I muted everybody earlier.
Okay, how's that?
Yeah, now we hear you. Go.
Okay,
Hi,
great.
Nancy.
Hi. I'm in Florida, and I like the idea of that website that you gave earlier about the PTLC of sciences. Anyway, my question is, I'm going through stem cell recreation for my knees. I was supposed to have knee surgery, and when they go through the testing of surgery stuff, they found out my carotid arteries were both over 70% clogged. So before they could do anything about it, I had my stroke. So now it's been a year, and I'm working, like I said, on stem cell recreation in my knees. And it's not being paid for by Medicare or TRICARE or anybody. I'm having to pay for a lot of it. But anyway, my question is, I heard you say something about stents and not doing chiropractic adjustments. And I'm traveling, so I got cut out at the time. Can you tell me, am I not supposed to have they do chiropractic adjustments for my whole body to help my knees? I can't say I quite understand it, but it's part of what I'm paying for.
Aligning your body.
To align my body.
So if you had a stroke from your carotid arteries, I
Yes.
probably wouldn't have them adjust your neck.
Okay.
Yeah.
They
They can adjust everything else, but not your neck.
Okay, but I've already had it done. So should I have them stop doing it?
Yes.
Yes.
Yeah.
This is
Okay,
Bruce
okay.
Hetzler. Sorry to interrupt everybody here.
That's okay. I was going to call on you. I saw you.
Okay. But in general, it's not a good idea to have a chiropractor adjust your neck. I have read too many accounts of people having strokes as a result of that. In fact, there was an account in the news, I don't know, probably sometime in the past year. I think it was a woman who was a college student, had a minor problem, went to a chiropractor, and she's now paralyzed on both sides of her body.
Wonderful.
So you really have to be very careful. Don't let anyone adjust your neck, because it can tear an artery and cause a stroke. Now, as far as the stem cell in your knee, what exactly are they doing? Are they injecting stem cells directly into your knee?
Yes.
I'm not familiar with research on that, but you do have to be leery of stem cell treatments. They are unregulated, and we really don't know that much about stem cell treatments. They have great potential, but that potential has not been realized as yet. Oftentimes, stem cells are injected into your arm or whatever with the promise that it will get to your brain and help heal a stroke. And that's utter nonsense. Stem cells can't get through the blood-brain barrier and get to the area of the brain that's damaged. Now, as far as your knee goes, they would have to be injected directly into the area that's a problem. And I'm still not sure of the research there. I would ask them if they've published anything of their results. Just having individual patients tell you how good it is really not useful. Individual case accounts are almost meaningless. You
They're
need a
not
carefully controlled double-blind study. I'll be quiet.
They're usually not patients. They're usually actors in some of those videos. Yeah, the other thing is, people tell you that you're going to take stem cells orally. Abraham, will get to you next. If people tell you to take stem cells orally or they're going to inject them into your bloodstream, how are they going to find where they need to go? In fact, in brain research, the Mayo Clinic and Stanford are the only ones who've gotten any real results, and they both don't know what to do now because they inject them into the brain to get around the blood-brain barrier, and what do they find? The stem cells die, but they created an environment that helps produce more neurons. So there's goodness there, but they really don't know how to make it work at this point. Dr. Hetzler, looks like you got something else to say.
Yeah, well, no, you're correct, Ralph. What they did at Stanford is drill a hole in the skull and inject a long needle into the core of the ischemic stroke and inject stem cells there. Those stem cells did die, but they released compounds that promoted generation of new neurons, and that did improve things. But at all these clinics that pop up, like a Jack in the Box or something, they're not going to do that. They're going to take some cells from your arm, inject them in your other arm, and say, "There, give me $30,000."
Yeah.
Well, yeah. And eventually, the other thing is, even if they create new neurons, guess what? They're not trained. They don't come pre-programmed. And they particularly don't come pre-programmed for you the day before your stroke. So everybody seems to think, that if they get stem cells, it's going to magically return them to a previous state. And that will never be the case. In fact, once they figure out how to make them work, they're going to have to figure out new modalities for training them, unless it works exactly the same neuroplastically as regular recovery. You like that adverb, Dr.
I love
Hess?
it. I love it.
All right. Well,
Wow.
back I struggle with my adverbs sometimes. Anyway, well, especially with something like that. Anyway, so back to massage. Can you have strong tense depths? Okay, that's back at the top. Just making sure there are any other questions. Oh, Abraham had a question. That's right. Sorry, Abraham.
Am I unmuted?
Yeah, you're unmuted.
Yes. Hi, Abraham.
Oh, okay. Hi, how are you?
Good.
I just wanted to shoot back to Angelia's question about how she was saying she's working out a couple hours a day, and you're telling her to work out less. Isn't that kind of counterintuitive to building stamina? I'm 30 years old. I've been
Okay,
through it.
so
I
great
understand.
question. Great question. It is not counterintuitive. And the
Why not?
reasoning is that what happens to the body is that you end up fatigued and you end up needing to rest 2 days a week, and then your body ends up back in the state of the stroke. And exactly what Angelia said, she ends up with that side of the body being weak and not being able to do the things she used to do on that day. So it's not counterintuitive. You want to go backwards a little bit so that you can do it every single day so that you're more functional every single day. Does that make sense?
No, it does not. Like I remember doing stuff on days where I felt like I couldn't even, lift up a broomstick, and it helped me. I mean, in the long run, it helped me. Like maybe the next week or the next day, it didn't, but overall, it did help. I don't know.
That's science.
Okay, well,
Go ahead,
so
Ralph.
that's just a single personal. What was it? Dr. Hetzler mentioned it's a single, personal story.
Anecdote. Yeah.
An anecdotal report.
Yeah. Okay.
Okay.
Speaking of Dr. Hetzler, I believe he's leaning in because he wants to ask the same question that I want to ask, and this is not meant in any way to be argumentative or
No. Go ahead. Please ask. Go.
Okay, so Dr. Hetzler taught us about a little something about something called mass practice that Dr. Edward Taub developed at the University of Alabama, which is that I'm sure you're familiar with mass practice, Rachel, doing a bunch and putting it all together. So it seems kind of, actually in your last explanation, I got a little bit more out of it. It seems like that's going against the principles of mass practice, but maybe what you're saying is back up enough so that you can make sure that you do it every day.
Practice to the people that were not in Dr. Hetzler's class, because there are people here that were not. So go ahead, Ralph. I'll give
I
you
can explain mass practice if you wish.
Yes, please, rather than me do the job.
Okay, mass practice involves exercising for an extended period of time. For example, if you decide you're going to exercise for 4 hours a day, one option is to exercise from 9 to 10 in the morning, and then 11 to 12 in the morning, and then 1 to 2, and then 4 to 5. That's 4 hours. Another option would be to exercise from 8 in the morning till noon. That's 4 hours straight. And that second option is massed practice. And Edward Taub's clinic demonstrated that it is the massed practice that produces results, that activates neuroplasticity. Now, for a stroke survivor, you do have to deal with post-stroke fatigue. That is, you do get tired more readily than someone who has not had a stroke. So you may not be able to exercise for 4 hours straight. Maybe for you, it's 2 hours straight. But the point is to do what's tolerable for you on a given day and try to do it every day if you can. You may want to take the weekends off. Well, guess what? Your stroke doesn't take the weekends off. You still have your stroke effects on Saturday and Sunday. So you should work too.
Okay. So thank you, Dr. Hetzler. So
you're welcome.
That was part of what I was explaining. Your stroke does not take the weekends off, and therefore you need to exercise every single day. And therefore, my explanation was that it is better to reduce the amount of time that you exercise so that you will exercise every single day. So if you're seeing that if you're exercising for 2 hours a day, but you're taking off 2 days a week because you're exercising 2 hours a day, then reduce the time that you're exercising and then exercise every single day, whatever that time may be. For you, it might be an hour and a half. For somebody else, it might be an hour. For somebody else, it might be 45 minutes. Start with 45 minutes and up it by 15 minutes, by half an hour, and see how long you can go and still do every single day. But
Got
you
that?
have to do it every single day. You cannot miss a day because stroke survivors have to do it every day. You cannot miss a day because your gait, your speech, and your balance are going to suffer.
So Angelia should back off some, whatever works for her until she can get to where she,
don't think so. Everyone should
Okay.
pretty hard.
and then she can build back up to her 2 hours as long as she can maintain the everyday. That's what I got from the second time you explained it.
Yes.
Yeah, I don't.
So I hope that explanation was a better explanation.
What?
I hope that explanation was a better explanation.
Okay. Abraham, did you have something?
Yeah, that sounds silly to me. It sounds like it was read in a book. Like, I mean, I think Angelia is saying she goes like a couple hours a day and she takes days off because, I mean, everybody takes days off. I take days off, but it doesn't mean it's because I'm so tired I can't lift a finger. That's insane. I just take a day off because your body needs to recuperate. I mean, muscles need to grow. That's how it works. You work out, you stretch them, and they tear and they heal. That's
They'll
how that
recover
works.
overnight. They'll recover overnight while you're sleeping.
Oh, really? All of
Yeah.
them?
Yes.
Yeah.
I'm with Dr. Hetzler. Sorry.
What?
I'm with Dr. Hetzler. Sorry. They recover overnight.
Uh-huh.
You got to do it every day.
I'm not saying that. Whatever. Yeah, you know, I understand. That's good though. All right, I understand. That's awesome.
The other thing is, it may be different. You're 30 years out, and Angelia is about 3.5, I think.
Like
Four.
I said, it's a personal anecdotal story, so
Uh-huh.
it might be different. You're right.
Agreed.
I just, yeah.
I have
don't
a
know.
question. If my
I have a different theory
yeah.
about it, about strokes. I mean, but that keys back to the days when I first woke up from a coma. I have a totally different outlook than everybody in here, probably. I'm not going to relent. The stroke never is going to relent. You have to work every day. It's not going to take Saturdays and Sundays off. You're exactly right.
Okay, well, now you're agreeing with Rachel. Anyway,
Well,
so
I am, but I'm agreeing with her because she's true. That's right. It's not going to take a day off, but it doesn't mean you can't. You just have to live with the effects of it.
well, I mean, what you need to realize is the consequences. We all, well, I don't get sick much, but we all occasionally get sick and or have something that comes up where you have to. What Rachel's saying is you want to shoot, the target is to do it every day, not let anything interfere. Back off to where you can do it every day and then build back up if I've got it right. So
You do have it right. Yep.
Yeah.
Yep.
Yeah, and if you take a day off, you're going to regress. That is, you'll move backwards in terms of
That's
your
correct,
recovery.
Doctor.
If
Yep.
that's what you elect to do, well, that's your choice. But you got to realize there is a consequence. You can either move forward and exercise every day, or you can take a day or two or week or whatever off, and you will regress or go backwards. And that
So
is your choice.
I suspect you do something every day then.
Oh yeah, I annoy my wife every day.
Okay. Rachel, you don't know he's bad. He's known for his bad jokes, and he has a lovely wife in all ways. She's just a lovely person. She looks after him. He's a very blessed man, and he does not ignore her. I know better than that. You'd be foolish to ignore her, and you're not a fool. So, yeah. By the way, Rachel, he's Dr. Hetzler's a stroke survivor himself, and he didn't, just because he retired from Lawrence University after 43 years of teaching, doesn't mean that he's no longer a neuroscientist. He's just no longer on direct deposit.
Got it.
Well, he may be on direct deposit for his retirement benefits, but he's not teaching anymore, but that didn't mean that he forgot anything that he knows, especially not all his bad jokes or dad jokes. They're not- Oh, we'll get him to tell you one here in a minute. So anybody, I don't know if Rachel, you got any time constraints or if anybody out
I
there
just have one more question.
got any more? Okay.
Go ahead.
Rachel, I had hemorrhagic stroke 2 years ago after a stent. They did the stent in I had 2 aneurysms and my left side is affected side. So I have a lot of pain in my hip, left hip, and my shoulder blade to the point where I come every day to make breakfast. I'm making eggs. Let's say I have to sit down several times because I can just not stand. My hip is killing me.
Okay.
And I do it every day. I found on the YouTube a video because they never stretch me, and I learned how important stretching is. So I do this stretching in my bed in the morning for about half hour. But like you said, there are some stretches I can't do it. I need help, but I do whatever I can stretching my left arm, which like I said, that nobody ever did any stretching for me at the hospital. So every day I push myself, but like by 6 o'clock, I barely can even move. I feel like my left leg.
Hold on just 1 second. I'm so sorry. Hang on. Give me 1 second. I'm sorry.
Okay, Sophia, you're in New Jersey. Are you anywhere near Hillside?
Yeah, not that far at all.
Well, that's where Rachel is. And I have one question that's left over from before when somebody was talking, Judy or somebody was talking about it, and that would be massage typically is not covered by insurance. And my question is medical massage covered by insurance because you're working with a doctor, and it's now covered by insurance because you're working on a long range goal instead of the massage envy feel good thing. So that I'll let her answer that. I doubt anybody else knows the answer to it.
I've gotten a few medical massages paid for myself.
Okay, well, there you go. There is the answer. So Judy, who's no longer here. No, no problem. But, life comes first. We appreciate you giving us your time.
All right. So, Sophia, do you go to a massage therapist?
No.
Okay.
She's in New Jersey. She lives in New Jersey, not too far from Hillside. Uh-oh. Rachel froze.
Hang on.
Okay.
All right. Am I back?
Yes.
Okay. Sorry about that. Okay. Sophia, I don't see you.
Okay. Well, she's here. So she
Okay.
lives in New Jersey, not all that far from Hillside. So I'm
Okay, so Sophia, there are stretches that you can do. Number 1, number 2, why don't you sit while you're making the eggs?
That's right. By the time they're done, I have to sit down several times because I can't stand up.
Why aren't you sitting the whole time? Do you have a bar stool?
No.
Get a bar stool and sit down while you're making the eggs.
I think I might have to look into that. Yeah.
And get massage therapy. Get medical massage.
Right. While you were gone, I said that one question I wanted to ask was if most massage, feel good massage envy massage is not covered by insurance. And I was going to ask you that. Angelia chimed in and said that she had some medical massage and it was covered by insurance.
So that's a good question. People that have third-party insurance, Aetna, Cigna, United Healthcare, with out-of-network benefits, it can be covered. I'm an out-of-network provider, and what I do is it's called a super bill. It's an invoice with the codes, and they get reimbursed. They do get reimbursed for out-of-network.
So it is covered. And so what I do is I have packages on my website that lower the price for a massage. So you're paying less, and my prices are a lot less than most massage therapists. And I bill the insurance more. So the insurance is going to pay out more than what you're paying. They typically, somebody just posted on the chat that it depends on your insurance. It does depend on your insurance. That being said, I spent 10 years as a patient advocate. So it does depend on your insurance, but most insurances will pay out. I have spent time on the phone with my patients and with their insurance. They'll give verbal consent for me to talk to the insurance company, and then they'll hang up and I'll just talk to the insurance company and get it covered. So it typically is covered.
So Sophia, you have an option that a lot of the rest of us don't have, and that you could check with your insurance. You work with Rachel, and maybe you drive over there and she could teach you some things. Just as
Yeah, I would
suggestion.
think I need to look into that.
Yeah. All right. Let's see. Really depends on your insurance. Concern. After stroke, that massage, especially deep, can cause blood clots to release. Very good question.
What's the question?
If you've had an ischemic stroke and you're prone to clots, can deep massage cause clots to cause blood clots to release and cause issues? Well, first of all,
Hi, I'm sorry.
Not to my knowledge. Go ahead.
This is Kristen. I'm a
Hi, Kristen.
medical massage therapist as well in
Hi.
New Jersey. I don't know why my video is not working. But
Okay.
yeah, I'm not practicing right now. My strokes were about 3 months ago. I have a vertebral artery dissection, probably from chiropractor.
Okay.
And on top of that, I can't even sleep well. 2 nights ago, I did not sleep all night.
Okay, let's have Kristen talk. Go ahead, Kristen.
Thanks. Yes, I would recommend absolutely no one get neck adjustments. I've been told this by many, my aneurysm surgeon. I have 3 aneurysms.
Okay.
I have the dissection and I had the strokes. I personally will never get another massage.
Okay.
Because of the concern about blood clots, especially deep tissue.
So,
Stroke, if you don't have all your sensation, it's very difficult as a therapist to get good feedback.
So it's a good question, but as a medical massage therapist, so I wouldn't go to a regular massage therapist. But
No,
as
I know that, and I am a medical massage therapist.
So
and I used to go to a medical massage therapist. I'm not taking the risk of having another stroke. Not happening. And I wouldn't touch anybody with the issues such as like I'm having the blood clots, the artery.
So,
not worth it.
So as a medical massage therapist, I'm gonna say this. There is no issue for having, I apologize, I'm on a bus. There is really no issue of stroke if you know what you're doing. I don't touch near the carotid artery. I don't go near major arteries. And I'm very, very careful. That being said, you really need to know who you're going to. You really need to make sure that they really know what they're doing. You really need to make sure that they're educated in stroke and in stroke recovery survivors. Because if they're not, then you don't want to go to them.
Well, you also need to make sure
I totally understand that. That's why I had to chime in, because as a medical massage therapist for many years now, might be something to just have people really think about.
100%. And Kristen, I appreciate the question. Thank you.
Mhm. Mhm.
Well, the other thing is, we should be working with your doctor to be on a blood thinner or whatever is required to not be growing clots anymore, because massage or no massage, if you don't have your, if you're not managing clots in your body, you can have another stroke without a massage.
100%.
Ralph,
100%. I just wanted
wanna
to
say
chime in
this.
as
So-
a medical massage therapist for many years. And just,
So I just-
everybody's
Kristen-
decision is theirs.
100%. So Kristen, I just want to say this. Ralph mentioned blood thinners. When I do my intake, I ask people about the medications they're on. Medications are very important, and often people leave it out of their intake form. When they leave it out, I say, are you not on any medications? You're 40 years old. You sure you're not on any medications? Are you on any supplements? Are you on any vitamins? And they're like, oh, yeah, I'm only on vitamin D. I'm like, well, that's kind of important for me. Why are you on vitamin D? Are you vitamin D deficient? And they think that's not important. It's important because it's going to change the way I look at you, the way I think about you, the way I deal with you, the way I deal with the massage. It changes everything.
Oh, I understand that. Most people don't understand.
Right, Kristen, you understand that, but I'm saying it for the benefit of everybody else on this call. So what I'm trying to say is, Ralph, you brought up blood thinners. If you're on blood thinners, your massage therapist needs to know that, right? I need to know exactly what you're on, because I have to change my massage. I will not go near major arteries. That's a no-no. But I also need to know what other things you're on. It's not, people ask me, oh, there's paperwork. Yes, it's like you're going to a doctor.
Well, yeah, it's the way it should be. I always list out, I take a multivitamin C and a couple of things, nothing exotic, but I always list all of the supplements that I take in addition to the medications. I mean, if you don't provide information to the people you're working with, how can you expect them to give you focused kind of approach? The more they know about you, the better they can interact with you. So
100%.
I always put down everything. In fact, the biggest problem is once you go off something, even a supplement, it stays in your medical records forever. I'm always trying to get rid of a couple of things I don't take anymore, but that's no big deal. Dr.
This is Bruce Hetzler again. Sorry to interrupt you, but there is new research now showing that taking a multivitamin every day helps to prevent Alzheimer's disease.
Yay! I've been doing it for 50 years.
So, there was a while when doctors were saying you don't need those multivitamins because you get it through your food. Well, new research says if you want to put off Alzheimer's disease, it's a good idea to take a multivitamin. I will also point out that vitamins, minerals, herbal supplements are unregulated. That is, they do not have to be shown to be safe or effective. And that's because of a law that was passed in the 1980s. It's a terrible law, but that's the way it is. It's not like a prescription drug. They don't go through double-blind trials or anything, so they don't have to be shown to be safe or effective. So the old expression, caveat emptor, buyer beware.
Yeah.
Be careful. Just because someone tries to sell you turmeric or whatever, it may not actually have that, and they've probably done no studies to show that it helps anything.
Well, turmeric's one of those things, it's a natural blood thinner. So you have to, again, another thing to bring up here would be that you really should be writing down on Rachel's intake form and everybody's intake form, all the things you're taking, because your doctor might not want you taking turmeric or fish oil or omega-3s if you're on blood thinners, or they might want, if you want to take them, they might want to reduce or or pull down the amount of blood thinning, because all those things are natural. And no, you can't just start taking turmeric and stop your blood thinner unless you're working with a doctor and they're suggesting that, because that's a good way to end up with another stroke.
A lot of people take blood thinners because they have atrial fibrillation.
Me.
Yeah, so do I actually. And but I don't take blood thinners, except I do take a baby aspirin every day. And I take medication for the atrial fibrillation. I take atropine every day. And that's all I need. But interestingly, when I got out of the hospital, I was taking about 10 different medications. And I didn't know what it did. So when I got home, I checked them all out. And I'd had occasional, not constant, but occasional atrial fibrillation. So when I got out of the hospital, I found out that I was on a drug called amiodarone. And that's a drug that's used to treat atrial fibrillation. Well, I looked it up, and one possible side effect is permanent blindness. So I thought, damn, I don't want to take that. So I immediately called my cardiologist and said, can I stop taking this? I said, oh yeah, that's fine. What should I take instead? I'll just take atropine. So that's what I've been on ever since. I don't take any of those other blood thinners. And my atrial fibrillation was just occasional. It would typically occur after I ate chocolate. And people with atrial fibrillation should not have any caffeine or chocolate. So just word to the wise.
So we're about the same age. We both had a right thalamic stroke. We both have AFib after the fact. I developed it at least 10 years after my stroke. I wonder if there's some connection there, but that's another discussion. Anyway, I didn't know there was any kind of medication or anything. Not that I'm looking to get on it. They talked to me. They said, nope, no ablation, no cardioversion, no nothing. You're fine. I guess I don't have it very much, but we're off subject again and taking up Rachel's time. So we got some new folks too. Anybody out there got any more questions before we let Rachel go and get back to her life and practice? Going once. I'll get out the auctioneer's hammer.
Yeah.
Going once. Winnie, you don't have a last minute question? Winnie always has a last minute question. We tease her about it. Okay, she's not sure. So I guess I'll wrap this up because I would, want people to actually watch it. And I wish there was a way I could put like 20 minutes on all the hour-long videos so people would watch them and get fooled. But anyway. So, Rachel, I'll put any and all information that you want. That also goes to everybody else. If you're looking, Sophia, to get in touch with Rachel, or anybody want to do Zoom, telehealth, or for any reason, I'll make
with anybody via Zoom. I do Zoom sessions. They're usually 1 hour, but if you need them, I could do them a half hour, 45 minutes. For mindfulness, meditation, or just a consultation.
Okay, well, I'll make sure all the information's down there, and Angelia is a part of our community, so she'll get with me about getting up with you, and same with Judy if she wants follow-up. Well, Judy's pretty good at finding and taking care of herself. She doesn't need a lot of hand-holding. So we want to thank you. I want to thank you personally. I want to thank you for everybody who came today. It was quite a big group. We usually get like 10, and we had about 30 today. So that tells me something. And so I want to thank you for everybody that came and everybody that's going to watch it on YouTube, because I think it'll be real beneficial. And
thank you very much for having me.
Well, thanks again for coming.
All right. Thank you.